Hi, everyone. I am delighted to introduce our next speaker, Dr. Naresh Trehan, world-renowned cardiovascular and cardiothoracic surgeon. Dr. Trehan needs no introduction. He is globally acclaimed and is always a very high in demand professional, and more so during the current COVID crisis. We are thankful to him that he has agreed to be with us at this critical juncture. He is the chairman and managing director and chief cardiac surgeon at Medanta, the Medicity, a world-class 1,500-bedded multi-super specialty institute which offers cutting-edge technology and state-of-art treatment facilities at an affordable cost. The institute is governed under the guiding principle of providing medical services to patients with care, compassion, and commitment. Dr. Trehan founded the Escott Heart Institute and Research Center, where he was the executive director. Escott was conceptualized, created, and managed by Dr. Trehan from year 1987 to May 2007. Dr. Trehan has received many prestigious awards, including the Padma Shri and Padma Vibhushan Award presented by the Government of India. Dr. Trehan was the president of the International Society for Minimally Invasive Cardiac Surgery, Minneapolis, USA, and also received honorary doctorate degree from 3 prestigious universities. He has achieved so much. If I continue to speak, I would be speaking. So without further ado, let me invite Dr. Trehan to talk about a very crucial topic today. In today's context, the future of workplace well-being and how we can ensure quality employment in this ever-changing context. Over to you, sir.
Good afternoon, and thank you for this privilege to be able to share some views with you about the happenings or the unfortunate happenings around us today. So when we look at the last year, it was a rude shock that something of this magnitude would happen in our lifetime, because in history books and medical books we used to read about 100 years ago the Spanish flu had struck the world and what havoc it had wreaked on everybody as far as economics and life was concerned. That this horror would repeat itself in today's day and age was not actually imaginable by any one of us, at least. So unfortunately it's happened, and here we are a year later, still actually searching for what to do. And actually, I think part of the world has been crushed by this whole thing, and there is further grief to come. So in that context, when we look back to say what happened in the first wave, when it started spreading around the world and India also received its share, that we locked down, complete lockdown, and it was announced by the government just overnight. And everything was frozen as is, where is. The idea behind that whole exercise was that people would be able to not travel or communicate with each other and be actually isolated in their own homes, neighborhoods, that it would break the chain of spread of this virus, which is actually has a higher RO factor, which is the one we talk about, how many, if one person will be able to infect how many other people, that was much higher than the previous infections that we had seen in a lifetime. Then, of course, when this spread, we were all, thank God for the lockdown in one way, that we were totally unprepared in our infrastructure to deal with this problem. So the medical infrastructure, the PPEs, the ventilators, the masks, and otherwise also the doctor's understanding of the disease and also how to cope with it was missing. So we used those 3 months to make a robust system to be able to deal with it. And we were gradually able to come out of it. People behaved themselves, they participated in the lockdown, and everybody has to be given credit that we brought it to a stage where we thought that it's time that India we can look behind, and people used to say, well, we will treat it like a common flu and it will come and will go, and that kind of feeling existed around us. So many things happened at that juncture, and this actually started around September, October last year, that people started loosening up. I mean, there was, whatever name you call it, whether it's COVID fatigue or cabin fever or just optimism, people started, especially the younger people, they felt less vulnerable to this disease, and also felt that now it's time, and for them to be caged for so long was a pressure on them mentally also. So when this whole mixing started, slowly it started increasing. And when first the wedding started with 10 people, 20 people, then went up to 50, then 100, 300, and now we witnessed weddings which are 400, 500, which was one event. Then, of course, there was Holi, then now there is Kumbh, and there is elections, and so all that stuff that happened around us threw caution to the wind. And we have now landed up with a wave which is much more severe than the first one. Now, you can blame what you can, but if you go back in history also 100 years ago, the second wave in that pandemic was also very severe and spread much more rapidly than the first wave. So this virus is also following the same pattern as was what happened in the Spanish flu, and also which happened in other countries. Now, for a while, India felt, the Indians, we all felt, that look, we have been vaccinated with BCG, we have a very robust immune system because we are used to street food and chaat and whatever have you. And then we felt, okay, maybe India will not see such a bad situation. And then there will be the summer, which will kill the virus. So all this wishful thinking kept happening, which is normal human nature, but it didn't happen. So we were able to control the first wave, although huge economic disadvantage took place. People suffered, especially the labor when they got locked up in one area. You all saw the exodus and how much they had to suffer. So that came out that one, there was suffering. Two, civil society actually came together to try to provide as much relief to people as they could. So that's the other part of our character that came out. Now what's happened is, how do we face going forward? So as far as the workplace is concerned, there were many lessons we learned. Technology hugely came to our rescue. And there was this whole concept of work from home became more positive than negative. So people started doing whatever they were doing, they got used to it and found themselves quite productive where if your job allowed you to work from home. I mean, people like us, we have been at it for the last 15 months. Doctors and the frontline workers and they healthcare workers, they've not had a single break really. Just when we were recovering, we are back into the thick of it. So what do we do in an office space? I think that's what you guys are more interested in. So we said in the very beginning that, look, let's open up slowly. And the three principles of COVID appropriate behavior must be maintained. This is what the recommendation was from the medical community. We were all, some of us on the joint committees with the government as making recommendations of how to open up air travel, how to open up hotels, how to open up restaurants. But sad to say, it was after a period of time, and that's human nature. It's not like it's only happening to us, that you start relaxing more and more. And what we found, people eating together with their masks off. If one got it, then everybody else on the table would get it. People started socializing. So there was violation of those principles quite extensively. So then what we have now today is to say, one, we know that the way we opened up, and it, it actually has landed up in some trouble. We need to revisit all our protocols. We need to start again with the fact that the learnings of what went wrong in our ability to open up workspace. So many, you can say industry did a good job. And we had done a planning for one of the auto manufacturers, and we understood that how there are teams of 4 to 5 people which work around one major machine. So we drew red lines around them and said one team should not go to the other zone. There were different zones made, and all these things were working actually. Now the point is that in spite of that, we have had this huge wave, and we are still in the middle of it. We don't know how far it will go. Some estimates are it will go to 4 or 5 lakhs per day. This is what happened in the US. And we used to at that time feel that, India has done it so well and the US doesn't know how to do it. Well, that was a false comfort that we had. Moving forward, there are some things which we will not be able to change. And let's start with the healthcare workers, the frontline workers, and all ancillary services, because life has to be maintained. The pressure on hospitals, the pressure on doctors, the pressures on all the other paramedical and other people is double today than it was last time. You cannot find a bed in any hospital. The hospitals are increasing more and more COVID beds. We are running out of some medicines. Fortunately, PPE production has been resumed. Then ventilators we have enough, and science has brought us to a level here that we can manage the sick much better today than we could before. So the other thing that has happened is that a lot of people have got 2 doses of the vaccine, and they're still getting it, but there's a small number, and they are getting a milder form, and they are staying out of the ICU. Whereas there is a group of people who got 1 shot, and they had not reached their 4 to 6 weeks, 8 weeks. Now, this is another controversial problem, that those people have also got it in between the 2 shots, and there are quite a large number in that. And then there were the people who had vaccine hesitancy, who were entitled but did not take it. And then there are people who fall out of the 45-year-old group who did not get the opportunity of getting it. So all put together, with the visuals that you're seeing of Holi, you saw from UP, from Haridwar, you saw of the Kumbh, from now we have Ramadan, and also the elections are everywhere. If what you look at on the TV is national elections, and under the surface, there are a lot of municipal elections, local elections happening. Put together, we are in a very deep situation right now. So my advice is everybody do a personal lockdown as far as possible. So what does that mean? Means that if weddings can be postponed, should be postponed, but if they have to happen, only 10 people from both sides and far apart in the open. Don't have many functions, just have 1 function. And if it has to be done, let's do it that way. You know the exams have been postponed. You know that different cities are imposing different kinds of restrictions, but the best restriction is that you use your own intelligence. No socialization, there is no need. You can be without dining soirees outside or going anywhere. Better hunker down for the next 4 weeks, 6 weeks, till this wave passes. All of us have a responsibility that, one, if we get it, the younger group gets it, they will infect their old elderly, and that's what we are seeing now, a really huge influx of people, 80, 85 years old, who have got infected. And that has happened because the younger members of the family have been out there, they brought it home, and they've given it to their parents. Now, if you've given it to your parents and grandparents, it becomes a very difficult thing to reconcile that you actually led to their either serious illness or even their demise sometimes. So, having warned everybody that, look, this is the scenario that is staring us in the face, how to steer yourself, those three principles of COVID appropriate behavior have to be practiced even double now. If you're going out where you will encounter many people, double mask. Do not take off your mask under any circumstances. Do not eat in groups. Do not drink anything in groups. Even air travel, be very careful. You do not eat or drink on your flight. Airport, I saw people will be very disciplined because the airlines are managing it, going into the aircraft. As soon as they reach the baggage belt, they start rushing to it and actually rubbing bodies, which violates every principle. So those are the things that I wanted to bring to the perspective. What I do want to take now is your question of what can we do in our workplace. So as I said, that you're all aware of the fact, work from home when you can, let's do it for the next 6 to 8 weeks. When the people who have to be essential in the office, they should be at least 6 to 10 feet apart. They should not be more than 50 people, even in open offices, which are so huge, because the air conditioning and air circulation cannot handle it. If you can open windows, please do so. If you can turn on fans, please do so. To always do something remote from each other. Do not try to, come in close proximity. This is a very dangerous virus variant, and this is much worse than what it was before. So doubly careful, even beyond what we did last time. Third thing is on the organizations. The organizations that you are working for should facilitate you in this, because transport is another very vulnerable spot. So transportation, being in the office and going home, and your office environment being safe by what I said, by ventilation, by better air conditioning, by distancing, that's the way to keep it right now. Don't be in a rush to bring back people into the office if you already haven't. But if you have, then try to thin it out as much as possible. As far as then vaccination, as you know, the government has, under a lot of requests from people and all that, said that it's okay to even import. We know there are 3 vaccines now. Put together, we get about 8 to 9 crore shots a month. Everybody's ramping up. We are hoping it will reach 12 to 13 crores in the next month. And let's see when the manufacturing of Sputnik starts even more intensively and the other companies ramp up, we have to reach a target of somewhere between 16 to 20 crore jabs a month. That means we want to accomplish that 60 crore shots that we have to give to 30 crore people, which we consider as will get us very close to herd immunity. So if we can do that in the next 3 months, there will be relief. So like I said, vaccination very important. If you have not taken it and you are entitled to it, please do it right away. Hopefully the rest of the age will keep getting reduced and opened up more and more gradually over the next month or 2. We should have plenty of vaccine. So, and now there is openness in being able to import vaccine also, although most of them are too expensive or require very severe minus 20 to 80 degree sort of freezing temperatures, and cold chain becomes an issue then. More than that, when you are at home, please maintain your own immunity. That means you must exercise however much space you have. Yoga is one of the best exercises, even in the smallest room that you may have. Nutrition, very important. Protein is important. And also stay away, or even when you are going to meet, if you are working and going home, always go home, change your clothes, take a shower. That's the most appropriate way of doing it. Then meet the family members and the elderly. Elderly, what I mean is anybody above 65, you should wear a mask when you go near them, because you never know. This is a very virulent virus. It has broken all other precautions that we had thought were adequate. It's going beyond that. There's more and more evidence coming that it may be in the air ducts, in the air conditioning. We don't know, but there is enough suspicion of that also. So all said and done comes down to the same thing. Understanding what has happened, understanding what helped, intensify what helped more, and that comes back again to the 3 behaviors which everybody has to follow. Second, the government to put restrictions as appropriate as wherever it's possible. Third is to test more, ramp up the testing so that you can detect earlier and isolate people or colonies or areas as you see the breakouts. And fourth is vaccine. So with all that, I think I've shared with you. I'll be happy to answer any questions that you may have, because I can go on for days, but then it's repetitious.
Sir, thank you so much for these good tips and insights, but, means, yes, as you said that there are alarming COVID cases, 2 lakhs, and it can go up to 5 lakh. Now, what would be your advice to, industries like healthcare, pharma, banking, manufacturing, and public sector enterprises? Now, means all these oil companies, they are all working. They can't work remotely. They are all into essential services. And what would be your advice to them, sir?
So let's go one by one.
Yeah.
As far as healthcare services are concerned, the only thing the doctors can do is to protect themselves with appropriate attire, depending on how they are exposed. So like we are saying to all our doctors, that everybody should wear an N95 mask, which is adequate protection from catching the virus, because it's quite effective in protecting. And if you're going into high infected areas like COVID wards and things like that, then the full PPE and double mask and face shield, all that. Do not compromise in that. You'd be interested in knowing from our past experience, and Medanta has been a major center for COVID treatment. So much so that not because of COVID, but before that, we have been named the best hospital in India. And we have also been named in the first 200 hospitals of the world and first 100 cardiac centers of the world. So this is the level of commitment we had from the very beginning, but we also committed ourselves to COVID with the same dedication. So when we received the first batch of 14 Italians who got infected, the government sent them to us. So we have the longest experience. So you would be surprised that the teams that were taking care of COVID, they got the least infection. Why? Because they were the most careful about protecting themselves. So it proves a point that if you're going to get exposed, no matter whether you are a healthcare professional or a frontline worker, you cannot violate the rules of this virus. The rules of this virus is that 99.9% you will catch it through your upper respiratory tract. If you are protecting your upper respiratory tract, whether it comes from hands and all that, nobody's very sure, but for adequate precaution, we say wash your hands 3-4 times a day, use sanitizers. We had stopped using it because we got the comfort. So we back to basics. That is one. And if you're going to go into a crowd, always double mask. Do not take it off while you're going. When people think that you're buying something and you won't talk to the retailer, you put it down to talk. That's you're undone everything you've done all the whole day. So do not put your mask below your nose, because that's one of the major areas where the virus goes in from. And certainly don't put it down under the chin, because the chin is not where it goes on in from. It's the mouth and the nose that it goes in from. So that's that. When you come to services like petrol pumps, which need essential services, right?
Correct.
Again, those people who are doing the service should be masked all the time. No eating together. You know, one of the natural tendencies is you want to eat with your best friend or the next 2-3 friends, and you see them all sitting together on a table and putting their mask down. But that's the time you have concentrated exposure. So let me give you the principles behind this. A very long time ago, very early in the year, last year, laboratory experiments were done, seeing if there is two people, one of them has the virus, the other doesn't, and they are less than 3 feet of each other, and none of them is wearing a mask, and they spend more than 15 minutes together, then the virus that they had put into this experiment would be found in the nasopharyngeal space of the person who doesn't have, with very high rate. So 70-80% chance, if you do this with each other, you are bound to catch it. However, if one of the person was wearing a mask, the one who had the infection, and the other one was not, then the chances become 50%. And if both were wearing a mask, then it comes down to below 10%. That is, the distance is the same, that is less than 3 feet, and they spent 15 minutes together talking to each other. If you increase the distance more than 3 feet, and you reduce the time for which the interaction took place, then it goes almost to zero. So what you're saying is, learning from that is that whenever you go meet somebody, both of you should be masked. Do not take off the mask to eat, drink, anything. Maintain a distance of 6 feet and try to limit your interaction to a bare few minutes, not 10 minutes or 15 minutes. So that's one defense one can have, but you have to have it consciousness in your mind, because of the fact that when you open the TV and you pick up the newspaper, you know what's going on around. Now, if you want to still ignore that, then of course nobody can do anything about it. But like I said, this is a people's war. We are in a war situation. We will lose the war if everybody does not behave seriously. So if we take it seriously, we will certainly win the war. We will sail through this. It will take us 6 to 8 weeks. We'll have to pay a price for it, but we will still make it through. Now, another warning I want to give is that this may not be the end of it. Previous pandemic told us that it tells us that there are 3 waves. So it may still happen. So masking and all the other factors that we tell you about the COVID behavior has to be continued, because when you receive the vaccine, even after if you've got only 1 dose,
yes,
many people will get it. If you have 2 doses, still some people will get it. And your immunity really develops 2 to 3 weeks after your 2nd dose. So then that still doesn't prevent you from getting virus in your nasopharynx. You can still get it from somebody, and then you can give it to somebody, but you may not get sick. You may get very minimum symptoms, but you can make the other person sick. So their mask will stay on for the next year, I think, maybe more. But if you ask me a guess today, by the time it works itself through the whole community, country, internationally, it'll take another year. That's what it took 2 years for the Spanish flu to go. I think it's following the same pattern. So it would be appropriate to say we are in for the problem for 2 years. 1 year has gone by. We just have to hunker down and fight the battle together. We will win the war.
Thank you so much, sir, for your insight. There are so many questions pouring in, but in the interest of the time, I just have to say thank you. And we will win the war. We will keep our faith up and fear down. Thank you, sir. Thank you so much.
Sure. My pleasure.
Thank
Okay, all the best.